de bons résultats. On s'est réveillé, la machine est lancée. Oyenga, Hanukala. I can Cameroon. I can Cameroon. Je suis le Cameroun. Je suis le vert ou jaune.
Cameroun, je suis le Cameroun et fier de l'être. Moi, je suis la nature, l'Afrique en miniature. Moi, je suis la diversité des cultures, des langues, traditions. Moi, je suis l'Afrique prospère qui espère des lendemains meilleurs. Moi, je suis l'Afrique qui accueille bras ouverts les étrangers, tous les horizons en fait. Moi, je suis le Cameroun.
Welcome to Cameroon, bienvenue à Djalé. Toi pour Asogene, Yawogan Bezier. Webou Babak Baka, Nebi ne fini. Ben Kava et Pati, Yakoule bien Beven. Welcome Yadingwa, unité, paix, travail, patrie, bine. À Cameroun, Yemene, bine bien, bien.
Nous sommes Camerounais et nous sommes fiers de l'être. Nous sommes Camerounais et nous sommes tous unis. Nous sommes Camerounais et nous sommes fiers de l'être. Nous sommes Camerounais et nous sommes tous unis.
I can Cameroon. I can Cameroon. Je suis le Cameroun. Je suis le vert ou jaune.
Lende Lambodiwa, Iso lende motomama, Soni Kwembadia, Dale Oboso.
I am Cameroon. I tell the youths of today that don't think about all the system. They've got what they had to do. Let's join hands, do something better for our country and the kids tomorrow. Let's do something that could change our lives. Let's join a campaign, clean up campaign. Let's join something that could make us rain.
I can Cameroon. I can Cameroon. Je suis le Cameroun. Je suis le vert ou jaune. I can Cameroon. I can Cameroon. Je suis le Cameroun. Je suis le vert ou jaune.
Yeah, I am Cameroon. Je suis le Cameroun. Munga le Cameroun. I want to tell the youths today, let's stand up. Work for a better tomorrow for our kids. Cameroon, we love this country. Vert ou jaune, we work up for thee.
I'm Cameroon, hey. Je suis Cameroun.
I can Cameroon. I can Cameroon.
shore. I am Cameroon. I am Cameroon. Je suis le Cameroun. Je suis le vert jaune.
I'm the green, red, yellow with the star at the middle. Love, peace and hard work is my motto. 299 cultures and language, I'm Cameroon. I speak English and French, unity is my portion. Lion of the jungle, African in nature.
Dans la main où est la tienne, together. Pas besoin d'être ennemis, qu'on soit des frères, qu'on développe. Open your mind, pour que ça aille, qu'on soit plus high. Voilà, à sous de royaume, soit un kanga. Jeune mouille le maillot, pour de bons résultats. On s'est réveillé, la machine est lancée. Oyenga, Han, Kala.
Cameroun, je suis le Cameroun et fier de l'être. Moi, je suis la nature, l'Afrique en miniature. Moi, je suis la diversité des cultures, des langues, traditions. Moi, je suis l'Afrique prospère qui espère des lendemains meilleurs. Moi, je suis l'Afrique qui accueille bras ouverts les étrangers, tous les horizons en fait. Moi, je suis le Cameroun.
Welcome to Cameroon, bienvenue à Djalé. Tout à coup à Sogene, Yawogan Bezier. Webouba Bakebaka, Nebi ne fini. Ben Kaba et Pati, Yakoule bien Beven. Ça, découvrir un amouan. À Cameroun, Yemene, Biatingwa. Unité, paix, Kaba et Patrie, Bine. À Cameroun, Yemene, Bine, bien.
Nous sommes Camerounais et nous sommes fiers de l'être. Nous sommes Camerounais et nous sommes tous unis. Nous sommes Camerounais et nous sommes fiers de l'être. Nous sommes Camerounais et nous sommes tous unis.
I am Cameroon. I am Cameroon. Je suis le Cameroun. Je suis le vert jaune.
Lende lambodiwa Biso lende motomama Soni kwemba dia Dale oboso
I am Cameroon. I tell the youths of today that don't think about all that system. They've got what they had to do. Let's join hands, do something better for our country and the kids tomorrow. Let's do something that could change our lives. Let's join a campaign, clean up campaign. Let's join something that could make us rain. Hey,
Cameroon. I am Cameroon. Je suis le Cameroun. Je suis le vert jaune. I am Cameroon. I am Cameroon. Je suis le Cameroun.
Yeah, I am Cameroon. Je suis le Cameroun. Munga le Cameroun. I want to tell the youths today, let's stand up. Work for a better tomorrow for our kids. Cameroon, we love this country. Vert ou jaune, we walk up for thee.
I'm Cameroon, hey. Je suis Cameroun. I am Cameroon. I am Cameroon. Je suis le Cameroun. Je suis le vert ou jaune. I am Cameroon. I am Cameroon. Je suis le Cameroun. Je suis le vert ou jaune. I'm the green, red, yellow with the star at the middle. Love, peace, and hard work is my motto. 299 cultures and language, I'm Cameroon. I speak English and French, unity is my portion. Lion of the jungle, African in nature.
Dans la main où est la tienne, together. Pas besoin d'être ennemi, qu'on soit des frères, qu'on développe. Open your mind pour que ça aille, qu'on soit plus high. Voilà, à sous de royaume, soit un kanga. Jeune mouille le maillot pour de bons résultats. On s'est réveillé, la machine est lancée. Oyenga, Hanukala.
I am Cameroon.
Good morning, everyone. Good afternoon, everyone, depending on which side of the world you are in. First of all, let me thank you all for taking time to be here today with us for our 14th edition of this Saturday get-togethers since the beginning of the COVID-19. As I see that there are several people logging on now. Typically, we give it 1 or 2 minutes for people to come on. But whilst you were all signing in, we had this poll going on just with a very simple question to know if mental health is actually a concern that needs to be addressed in Cameroon. And probably this was self-serving because everybody that took this, that responded to the poll, said absolutely yes, that 100% it was something that was necessary to be addressed in Cameroon. So again, I want to thank you all for joining us early, joining us on time, and we're looking forward to a very, very exciting debate with our guests today. So for starters, my name is Ari Obenson. I will be the co-host for today. My co-host is going to be Mamwa Jeme, and together we're going to keep you engaged for the next hour. Just some ground rules. For attendees, most of you will not be on video, and you will not be able to speak unless prompted to, if we have to do that. So the best way for you to stay engaged would be if you have a question or comment to contribute, use the question and answer section, which would be at the bottom of your screen. So you can drop a question there. We're going to try as much as possible to take as many questions as possible. We cannot guarantee that all the questions are going to be answered today. And even if we are not, we will find a way to engage with you one way or the other. We're excited today to have our guest speaker who has accepted to speak to us. She likes to be known as Mag. She's Mary Abanga. We're going to get to know her a little more as we go on with our session today. But we have been on a journey. We started out in response to COVID-19 out here in the diaspora. We started out asking ourselves what we could do.
Oh, really?
That doing nothing didn't seem to be an option for us. And so we started out with a goal of mobilizing the Cameroon diaspora to raise funds from the Cameroon diaspora to provide personal protective equipment for healthcare workers in Cameroon. And we choose healthcare workers because we felt that they were in the front line of this battle, and that if that front line collapsed, then the consequences could be disastrous for the country. Since then, we have learned a lot in these weekly conversations that we've had. We've raised money, we've distributed some material to in Cameroon. We've engaged healthcare workers in Cameroon and abroad. We've learned, we've grown, and our conversation has evolved. We're having this conversation today as a response to what we saw as an increasing need for us to address the healthcare situation. We did an impact survey where the healthcare workers had a heightened level of anxiety, which probably the expert would tell us is an indication of the need to address the mental health question of workers. So that's the journey that has brought us here, and each one of us has just been a piece of the puzzle, a really tiny piece of the puzzle, with each piece of the puzzle being as meaningful as every piece of the puzzle. So the contributions that Cameroonians in the diaspora have made, and Cameroonians in Cameroon, and the contributions that you all that have come here every Saturday to spend time with us have been really, really significant. And I want to thank you all for that. And I want to ask for more, that this could only be the beginning of what we're trying to do, that the opportunities of things that we can do are not just limited to COVID, but maybe a lot more that can make life better and build a more resilient Cameroon, that the next COVID would not have the kind of impact that it's having today. So that's the opportunity that this presents, and that's why I'm always excited to get to engage with you on this Saturday morning conversation. Saturday morning as in here in the United States, obviously in Cameroon, it is afternoon. Like every day, we will quickly go around and listen to an update from the members of the supervisory committee of this campaign. But first, I want to turn to my co-host, Mamwa. And Mamwa, good morning. How are you doing?
Good morning, Are, and good morning, everybody. Welcome to another session we're going to have on this ongoing series that we've been putting together to help sensitize Cameroonians about COVID-19 and address some of the problems in our society today. We are very excited to have you on board. We hope we're going to have some very interactive and fruitful discussions with your participation, of course. We look forward to having you engage on this topic, which is not usually addressed. And we're very excited to have Mag on board. She is going to help us delve a little bit deeper into this. Thank you, guys. And I look forward to all of you being here and taking part in this. Thank you.
Well, thank you, Mamwa. Just like you, I'm looking forward to this exciting conversation. I'm just going to do a quick tour of the members of the supervisory committee here. Bambod, I see that you just came on board. I was a little bit concerned. I know that you have some family issues that you're dealing with, but thank you for being here. If you don't mind, can you give us a quick update, keeping it at just about 2 minutes, on what we've been all about in the last week?
So good morning, everybody. My name is Bambot. So last week we had 29 people in attendance at the beginning. I think we moved up to about 33 later on. And we had two presenters, Dr. Che and Mr. Fuentama. Dr. Che, so from Bamenda, focused mostly on the positives or negatives he's seeing in Bamenda relating to the COVID. And in relation to the positives, he says he sees relative few deaths, a lot of team collaboration within doctors in Cameroon, or doctors within Cameroon and the diaspora as well. Among the positives was the fact that diagnoses were done on the spot these days, and there was an acceleration in the testing as well. On the negative side, he stressed the need that a lot of health personnel were getting infected, and this kind of demoralizes some of the personnel and patients as well. He also talked about the lack of PPEs, and also the unfortunate miscommunication or misinformation from the public about what's actually going on with COVID-19. Amongst these, he talked about the management of corpses, of those who died, and the fact that people who die are buried almost immediately. And this was kind of really put offish for some of the people on the ground. He also stressed that the fact that because of the socio-political crisis in the Northwest provinces, the Southwest provinces, moving medicine around the Northwest especially is a challenge because of all the checkpoints that they have to go through. And some facilities have been attacked as well. Mr. Fuentama was a recovering patient who was who literally just told us about what his experience with COVID-19. He was kind of very emotional about it. He works for UBA, and he told us that his company donated about 150 million CFA to the government of Cameroon as part of his own contribution for this. And they're trying to sponsor research on COVID-19 or whatever. And he also stressed the need for a shift of our mindset, because and they need to demystify the fact that COVID-19 is not a death sentence. By using positive affirmations about the treatability of COVID-19. And on that road, he was kind of, the fact that there were not too many deaths happening in the country was a bright spot for him, because given the fact that people are not socially distancing, they're not doing all these other things, the mortality rate could have been worse than it is right now. And so that's what we had from last week. Thank you very much.
Well, thank you very much. I failed to introduce Bambod as the Secretary General of the Cameroon COVID-19 response. So thank you, Bambod, for giving us that update. I'm going to quickly turn over to Treasurer Christian Tekwe.
Okay. All right. Good morning, everyone. Christian Tekwe here from Houston. I'm glad to be here again on another Saturday morning, excited to talk about the possibility of overcoming this obstacle of COVID-19 in Cameroon. On the part of the Treasury, we have been moving slower than we anticipated at this time. At this point in time, just from last week, we have barely inched up a little bit. We are still at the 26,000, almost 27,000 mark for fundraising, with about $10,256 in cash in hand. We still have some logistics issues to deal with moving our donations from Japan into Cameroon. We still have aspects of the project, the second phase that we have to respond to. So I call upon you, everyone present here, to donate as much as you can, contact or talk to people who have the capacity to do so. I have left the information on the right-hand side of the screen under a chat forum. If you click on chat, you'll be able to see the information through which you can donate. Bank of America, Zelle, Cash App, and through the website iamcameroon.org. So thank you once again for responding to this call, and we look forward to your donations, continued donations. Thank you, Ari.
Thank you very much, Christian, for that update on the state of our finances. Before I turn over to our communications director, I just want to reiterate what Christian said, that in the chat room, there is complete information for donations. If you find this worthy of donating, please do so. I also want to remind, we are also live on Facebook. So if you are registered and are attending and would like to share this on your Facebook pages, you can do so. We're running this on the I Am Cameroon Facebook page, and I'm going to drop in the chat box shortly the link for you to be able to share that. I will turn over now to our communications director, Phil Najeme, for an update on our communication strategy. And after that, we'll have Dahiru Jamu, who is the national president on the ground in Cameroon, that will also be reporting. So, Phil, take it away.
Thank you, Ari. Good morning, everybody, and welcome to another exciting session. As usual, it's always a pleasure to see you all committed and dedicated to this wonderful cause that we're trying to make a difference. As you all know, the fight is real, and we are in phase 2 of our activities, going at 3rd month. And we continue to create that awareness. We continue to look for means to get more funds to ensure that we're able to do what we're supposed to do, right? Our goal was to protect our healthcare workers, the nurses, the doctors, who tomorrow will be taking care of our own folks, our own brothers, our own sisters. And I really think it's very great to sit and see what so much we've done, right? The journey has been long, but we have so much to be thankful for, and so many committed people who've really entrusted in us their hard-earned money. We continue to reach out on Facebook and taking the feedback that has been provided to us from all the different folks. And they've been telling us, guys, sensitization. We want the people to be aware that a hospital is a place to go to. You know, we had Conform Musa come on. She did express some, same concerns around sensitization. So immediately we changed our focus a little bit. We started now listening more to people to come and tell us a story. We also heard about the impact from the psychological aspect as well. We're also tweaking that way. So from a communication perspective, our goal is the world needs to know, Cameroonians need to know. COVID is real, and these are some of the impacts it's getting, and this is what people are going through. And for that note, I'm very happy to say on social media, we're really reaching out to a lot of people. Yesterday's call, last week's call has been watched. Since it's now on Facebook, it has been watched by so many people. And we continue to hope that we reach out to as many more as possible. Right now, all I can say is we're getting the feedback. Phase 1 got us where we are today, but the strategy to get us to the next level will be something different. And I'm very glad that the folks who are working with us are very dedicated as well. I'm looking forward to more updates from Dahiru with the more feedback we'll be getting from the field, the testimonies we're gathering together. Our newsletter, which we released this month, was a huge success. Already planning what will be the strategy for next month's newsletter. I think this is something we are all dedicated, and we're so committed that we believe that with all of our efforts, we will continue to save more lives, we'll continue to create more awareness, we'll continue to ensure that the people of Cameroon will be better off and COVID will be behind us. But for now, COVID is here to stay, and we have a lot of work to do. But committed as you all are, we will make it, this will be a success. So thank you all, and that's my update. But don't forget my three things. If you see a message, please like, comment, share on Facebook, on WhatsApp. Please, your status, I always say just put it up there if you can. The flyers are very nice, they're beautiful, they're colorful. Put it on your status. It lasts for 24 hours. A lot of people have reached out to me and said, oh, I didn't know MAG is coming. Wow, Okay, I'll attend. Wait, how do I invite? So guys, please, any form that you can share the message, I'll be very delighted. And thank you so much.
Well, thank you very much, Phil, for the work that you're doing. We cannot make a difference without being able to communicate what we're doing, and communication means mobilization. So I hope that we can reach as many people to participate in this endeavor. In the last few months, we've been putting him under tremendous stress and pressure, running around in Cameroon and getting the team in Cameroon to support everything that we've been throwing at them. It gives me great pleasure to introduce and welcome Dahiru Jamo, who is the national president of I Am Cameroon on the ground in Cameroon.
Thank you, Ari. Hello, everyone. Good morning, good afternoon from wherever you are. So for updates in Cameroon, we all know the statistics, numbers keep on increasing. It's true that the number of people that are getting healed from the COVID, it's quite also increasing, but the number of deaths are still there. But I wanted to draw our attention today on the fact that in Cameroon now, people behave as if COVID is no longer there. If you go to the markets, if you go to the streets, in the bars, everywhere, people are just moving around as if COVID is just cough and it has passed, whereas it's not the case. Because 2 weeks ago, my team and I were working on putting in place a documentary where we went to most of the places where the PPEs we fundraised and gave reached. So we could touch Boya, Bamenda, Yaoundé, Douala. Yeah, we could touch those places. And I mean, the feedback from the doctors were that people continue coming with COVID-19, and that the need for us to continue providing these PPEs is more than essential right now. We've done the first phase. They are very, very grateful. They are very grateful for what we did, because they said we came in time. The support the government has been giving to most of these hospitals is not quite enough, so they needed, and they still need initiatives like this one to keep on helping them, to keep on protecting them, because they are in contact with these cases. So in a nutshell, they said infected people, the numbers are increasing because, as I said earlier, Cameroonians think that COVID it's in the past now, whereas it's not the case. So they just move around freely without face mask. They don't social distance anymore. They don't even wash their hands anymore. You see people entering into restaurants, into supermarkets, without taking the necessary measures to prevent the COVID-19 crisis. So most of these doctors are very grateful for the first phase of this project, and they are really calling us. There's this thing they most of them said they are like Oliver Twist. I'll quote them. They said they are saying thank you, but they need more actually. So the documentary, we are still working on it. It will be available very soon, by next week. So you will have it. I will share it with the supervisory committee that will look if there are some final touches, edits to be done, and then we will have it. But it was very successful. The doctors are very happy with what we did, and they are really, really grateful. So Ari, these are the few updates I have for this week. It's rough. Been a little bit busy this time around. Haven't really been on the field. So if there are any questions, I mean, if there are some proposals, I'll gladly take them. Thank you. Ari, you're muted.
You're mute, Ari.
Yes, I am. Thank you very much, Dairo, for the work that you're doing in Cameroon. I know it has been very challenging with everything that's going on. So we're truly grateful. To everybody on the supervisory committee, thank you very much. I want to extend my regards to Dr. Muntio for joining us from the UK as well as everybody else. I saw Ma was here and Lillian. But at this point, I'm going to turn this over to Manuel. Let's go on to the second part of our conversation this morning, which is engaging with our guest speaker. So, Manuel, if you don't mind proceeding with an introduction of our guest speaker.
Hello, everybody, once more. For those who are just joining us right now, welcome on board, and we're happy to have you here. And today we have Mag, as AKA, as her real names are Marie-Angèle Abanga. She is a psychotherapist, she's an activist, she's an author, she's a lawyer. She has many hats she wears. And today we're going to delve into a topic that we don't usually address. In our society today, we are willing to engage in discussions about topics, about politics, about religion, and other controversial topics, but we tend to withdraw when it comes to the topic of mental illness or mental health. And today we're going to not really cause a ruckus, but we're going to delve into this taboo topic and see how we can have meaningful discussions and constructive discussions on how mental illness impacts our societies, our lives, our families, and the society as a whole. Given a lack of or a limited education on this topic, it's the dysfunctional health systems across the world, we need to address this head on. And if we need to make change in this domain, it's something that we need to accept as present in our societies and just talk about it and come up with ways to address it and have it dealt with. So I'll just take an example before I bring the specialist on. So we don't, when we stub a toe, you write in pain and you go, oh my goodness, this hurts. You're not ashamed to share that. So it is kind of illogical, and it's not actually ethical even if you have a pain that is in you, which is caused by some illness or some disturbance or a disorder, PTSD, suicidal thoughts, mental illness in general. These are things that we have to address. So that being said, I'm going to pass on the mic to our speaker, Mag. We are very excited to have you here today and to talk about this particular issue on mental health, which we're all grappling with, especially with COVID-19 and the sociopolitical situation in Cameroon over the last years. It's lasted for way longer, but it's a very timely topic. So why don't you just go on and tell us about yourself? Tell us how did you get to becoming, just like I said, you have many hats that you wear, but today we're just going to focus on you being a psychotherapist, and we'll delve into the other matters in a little bit. So welcome on board and tell us a little bit about you.
Hi, everyone. Thank you so much. I don't know if I should say it's a shame I didn't know about I Am Cameroon. And I'm pretty much on social media, but I'm focused on doing what I'm doing there. But so it was very interesting when I found out there was such a big platform and there's an active diaspora. Seriously, well, I was in Brussels in 2013, and my brother was diagnosed with epilepsy at the age of 11, and then he had a mental illness and he died in 2014. I myself had a lot of issues. I didn't even know what they were. I was diagnosed with post-traumatic stress disorder in 2014 out there in Brussels. And I said, now it makes sense. So what do you want to do with this? Are you stopping at just knowing what's going on with you? Or are you going to learn more so you can come back and help your community? And at this point, I want to thank Mr. Benson because he talked about the JCI. I was in the university and I never forgot. It was like, what a big vision. It's like, don't just leave school and look for a job. Leave school and think about what you can do for your community. So that's why I decided to take on a psychology course, and then I also got a diploma in cognitive behavioral therapy, and with distinctions, just 1 year, you know, it was like, wow, could I do this thing? And I decided to come back to Cameroon in 2015. Well, you know, trying to settle down and stuff. And in 2018, I started to practice. And then I worked in La Quintini, the psychiatry work for 2 months. It was so hectic and everything. I decided to come and open up private practice and then create an organization too. So I'm into so many things, as you say, but I just realized that mental health is something we don't really want to talk about. And I'm like, okay, I'm going to talk about mental health. You know, like where people don't go, that's where I want to go.
Exactly. That's exactly what we're supposed to be doing in these instances, especially because, I mean, most of the people participating today are from our community. We are all from Cameroon. We always get into these situations where somebody who is challenged with a disorder or has emotional problems is usually termed as crazy. And I'll say it, we all speak pidgin English. So something would happen to somebody and they go like, die Chris, don't start again. Or they go like, that one, seriously, just leave it on that Chris, you know. It run for family, not family thing. It surprise you. So these are things that we have to also understand. I don't know if you would agree with me, but we have to understand that these are things, it could, mental health disorders could be hereditary, but these could also be caused by trauma in our lives that actually trigger these emotions. And you having somebody who goes through these disorders, having a confidence to talk about these things is very important. But most often, we know how religious our communities are, and people go, just put everything for God in hand. You go, I don't think so now. Just put everything for God in hand. You go work out. What do you say to that? How do we actually address this directly without having to shove it under the rug and go like, okay, this is something we don't have to talk about. Let's just put it in God's hand.
I think that the pandemic has done a lot, frankly speaking, as far as mental health awareness is concerned. We have all gotten to our knees in one way or the other with this pandemic. We have all been stressed to the edge. We have all been anxious. We have all lost sleep in one way or the other. We've all been so concerned. We've all been like afraid of death in a way that you didn't see it before. People may be going out now, but in March and April, people were not going. I wasn't going out of my house, but I'm in my office today, which is not even far from my home. But so you see, people are gradually saying, okay, this is it. We can't keep running away from this thing. And even if some people don't want to say, I was struggling or I'm still struggling, what could be going on with me? A few people are beginning to realize, just like you are doing, right, that we have to talk about this. And those of us who have started talking before COVID, I mean, it's just like we have the whole world listening to us now, right? Okay. So people need to continue.
I'm gonna accept Ari. Ari, you have something you want to chime in, or I can just go ahead and I have another question for Mag.
Yeah. Well,
Okay.
I want to know. So I've been out of Cameroon for a while, even though I've been visiting there. I don't live there, but if I can recall, well, living in Cameroon, I don't recall seeing any psychotherapist in Limbe, maybe even Douala for that matter. So when I heard about this, I was like, how are you fitting in society? So how are people embracing this as part of their lives, knowing that there's a lot of issues that are already out there?
It's a very subtle process, but you know, I'm not in a rush because I know it's not a domain that people are comfortable with and people want to even acknowledge. And while this is Cameroon, what I notice is that people would come to me or go to the hospital as a last resort. people would maybe first go to church or go to the native healer. So I'm going to take time to penetrate the market, if I can put it that way. But I'm already having clients, and even if my rates are very minimal, because for me it's community work. Frankly speaking, I love what I'm doing. So the people who are coming, I'm like, wow, people are beginning. I started in 2018 in La Quintini. Well, people don't have a choice. When you go to see the psychiatrist, they're not psychotherapists there. So when I was there, it was flooded. It was such a new thing for people to not only take their meds, but go and see somebody with whom you can talk things through. Okay, so some of them stayed on with me when I left, and other people too. Yeah, and especially with COVID now, I've had a few patients. I've worked with them, and gradually.
So I was just going to add to that. So just like you said, it's something that is, as Ari said, it's something that is not very common in our society or in our community. So I was just wondering if how do people come to you? We have a culture where this is a topic that this is something that we don't even acknowledge. We don't want to say somebody is not feeling well mentally. So do you have people intercede on the patient's behalf, or do you have the patients come to you directly? How does that work?
Well, I have a website. I'm on CameroonBusinessList.com. I'm on social media. So people refer others to me. Other people search. People are beginning to realize that when something is not going on well, you don't only need to go and see a psychiatrist and take medication. You need to work with a psychotherapist. So people reach out to me. A lot of people, my clients, are above my age, and then some are the younger guys. They just found me on the web, and I've even had a priest refer someone to me. I have also had some other doctors, maybe a neurologist, not maybe a neurologist, a psychiatrist, refer people to me. So yeah, that's how people come.
Okay, so we have a question from Christian. Christian would like to engage you a little bit more on COVID-19 and with the pandemic and how that is being handled. Christian, I'm going to hand it over to you. You want to go ahead and ask your question?
Thank you. I expected you to read it, but
okay, I could
so
do
Marie,
that.
Marie, thank you. Let me have the opportunity to speak to Marie. Thank you, Marie. Thank you for all the work you do, and as you say, it's a road that is not traveled by many. We appreciate you being in the forefront and bringing this to light. Mental health is very important, especially for healthcare providers, as they're actually the soldiers of this war with the COVID-19. I'm wondering if you have any experiences in your work with healthcare providers and in terms of how the pandemic is affecting their ability to do their work, or even just personally and professionally, and if there are any resources or you do any work with them in terms of their resiliency.
Yeah, my colleagues from La Quintini reach out to me because, well, we've kept in touch, and also one lady in a private facility and in a clinic just nearby where I used to consult, those colleagues too, because there are people everywhere. The numbers are there. So there are people, and some, they just come to the hospital. And in La Quintini, for example, that's really like the main place in Douala. They are overwhelmed. And it was not like there was a unit for COVID when COVID just started. So when it just caught us unawares, for example, in March, they took staff from the different units like psychiatry, where it is usually not even overpopulated, some from neurology. And so, and they don't have many in the first place. So that shortage, and they need to work overtime and everything, it was just filling them with so much stress. They were concerned about what they could take back home in terms of infection. They were concerned about what they could take even at the job site. Their bosses were angry and taking it out on them, and they could easily take it out on the patients. And well, they could make mistakes. When you're panicking, you may forget to put on your gloves. You you may take down the mask, and then before you know it, well, our system, right? Maybe the bed was not properly disinfected, and only the fear of the possibility of getting infected, it can make you start to panic. And when you start to panic, anything can go wrong. And you go back home with that anger and that frustration, and you take it out on your kids at home. So 3 of them reached out to me, and we walked some, and we walked, and I told them, you need to be able to tell your boss that this is where you are right now, and you can't go on like this, and you can't work 20 hours, and if not, you're going to fall sick. One actually fell sick. One actually got the COVID themselves. And so it was really something they had to look into. The other lady at the private facility here, well, good for her. She had a boss who could understand, and the numbers have started to reduce, and then they got some other people, because sometimes people don't also want to hire more people. And then, well, she recovered, but what happened is that her mother also got infected, and then her mother died. So yeah, I've really had to work with some of them, and that's why I personally don't joke with safety measures and whatever is happening out there. I'm like, you people don't know. It is not a death sentence, but you need to be very careful.
Wow. Well, thank you. But are you alone? Do you do this by yourself? Do you have a team? Do you have trained subordinates?
No, I haven't, because I was not also waiting for COVID, right? So I'm still doing a master's in psychology. So I want to finish before I can start training other people. I don't just, I have my diploma in cognitive behavioral therapy and another one in psychology. Now I'm doing a master's as a Commonwealth scholar. This is my second and final year. When I finish now, I can start training. I don't just want to rush.
Okay.
Can I quickly jump in? Are there other colleagues, psychotherapists or psychiatrists that you are exchanging notes with at this time on how to deal with, say, these healthcare workers? Because this is only the engagement that you have had, but I bet that across the country, this is something that is repeating itself in various cities and towns across the country. I also know that you're part of an Africa-wide association. What are the conversations that are going on, and how are people developing strategies to help people that are in need at this time?
I belong to the Global Mental Health Care Network, and I have a few colleagues there, but they're not from Cameroon, but that doesn't matter. I mean, it's the same practice. And there's one from Nigeria, we really collaborate. And then, well, I also joined another group on WhatsApp. It's called the Forum, and it's really for people who are interested in Cameroon, and some are Cameroonians working in Bamenda and in Boya and of different professions, but I mean, everybody has this interest in mental health. And I just wrote to a colleague now to refer a client in Bamenda to them. So gradually, I'm building and belonging to a community of practice. And I didn't even know that there were other people too when I started. So I'm excited to know a few other people I can talk with. I know there's a Cameroon Psychology Association of Psychologists. I don't know how grounded that one is. I've been trying to do some research about it, but it's like, I don't know how things really work out in Cameroon. So I don't also want to push. So I know that I will get there, but I'm doing what I'm doing.
Okay, guys, so feel free to drop in your questions. We're here to handle those, and let's talk to Mary, who is, as she told me before we started, we got on the call. She is here to break it down to us the simplest way we can have it for all of us to be on board and to understand what this is and how crucial it is to our lives. So feel free, even if you just have some comments that you want to make, go ahead and put those in the chat section or the Q&A section, and that's why we're here. We're here as a community to educate each other and empower and inspire each other. So go ahead. I think I'm going to...
If you don't mind, I see that Besem Oben has her hand up. I just want to reiterate that, Besem, if you could if you could just write out your question in the Q&A section, we'll be happy to pick that up.
Thank you. I see that Phil has a question for Mag. Phil, I'm going to hand the mic over to you. You want to go ahead?
Yeah, sure. Thank you. Thanks, Mag, for joining, for being a part of this conversation today. I just wanted to ask, based on what you're seeing here in America, back when New York really took a heavy hit, we did witness one of them healthcare workers, she took her own life. And that has been a common scare for everybody. And we wonder, are there more that we don't know about? Again, if that could happen here. The question is, do you see that coming up in Cameroon? Do you see that that could be a potential risk? And if it is, what are the things that we could do to really help to try and prevent such a thing from happening back there from your own perspective, please?
Thank you. Yeah? Can I?
Yes, you may, Mary. Go ahead.
Okay, so healthcare workers, especially the ones at the front now, they are exposed to so many hazards, and they are at risk of infections and burnouts and all of these challenges. And I want to believe that if you don't have that support back home as a healthcare worker, it will be easy for you to slump, to just be so frustrated about the situation. And if you don't have no support, you can just, you can do anything. When you are mentally ill or challenged, the brain doesn't work the same way like when you are high functioning. So yeah, it can happen in Cameroon. People are getting more and more angry. People are getting more and more vindictive. People are taking out their frustrations on others. The rates of domestic violence has increased. So it could be a home of a healthcare worker, right? Partners are killing partners. How many cases have we had in Cameroon already? We are not even talking about them anymore. We are tired. Domestic violence has increased. Just imagine if it was the home of a healthcare worker. Maybe people are just not talking. I haven't worked with so many. So who knows what has happened somewhere and we just not heard about it. What I can say is that people need to be aware of the enormity of the work these healthcare workers are doing and the strain that they go through. Even you in your job, sometimes you are faced with this challenge on what decision to take and how it will be viewed by, let's say, the client, and what you're going to get out of it. Okay, but now a healthcare worker is thinking, do I leave them this way or that way? Am I really protected enough? What if I go too close and they cough at that particular moment? Does that mask really protect? And the shield and the gloves and the heartbeats, even without any contact, close contact, just going to work. I had one, she said she doesn't want to go to work, but she has asked for permission and they said, no, there's no permission at the moment. So you see, there's already that fear in her, that anxiety. Who knows what she was already dealing with before? If I don't tell you I live with post-traumatic stress disorder, you wouldn't know. But if I'm exposed to trauma now, I'm going to react in a very different way. So I try not to be exposed to any situation that can trigger me, including working in a hospital. That's why I left La Quintini, because I was just seeing too much suffering. And I was like, I'd rather be away and get a few people than be where I see people coming in chains and all of those things. So just imagine a healthcare worker now at the front line like that. So what I think is that
Oh, I think Meg just she just froze. So we're just going to continue engaging our participants and audiences and our audience in this discussion, and hope that we get her back. We know how the connection is back home. It's not the best. So here we have a question from John, who said, well, I'm not going to ask the question. Of course, Mag is not here, but it's something we can all ponder on before Mag gets back on board. So it's how he wants to know how we can convince a strong man or men that seeking for help and as from a health specialist is not a sign of weakness. Well, I'm going to just not speak from the perspective of a specialist here, but I would just say we're all human. Before John, I hope that Mag is going to take your question when she comes back. But I'll just say that we're all human and we have physical and emotional challenges which we go through. And sometimes we really do perceive asking for help as a weakness from.
I'm back.
Okay, Mag is back.
This is Cameroon. This is Cameroon. So I know you people understand Cameroon. So I was just saying that you can stop going to work out of frustration. That will be a source of livelihood that you have lost. And you can imagine the frustration now. Or you can continue working and you take it out on the patients or on their families. And that only send the same cycle, vicious cycle spirals. And before you know it, you've lost your mind, you start talking, you start acting funny, and you become a patient too. So what I think is we have to show more kindness, we have to show more tolerance, especially towards health workers. And if there's a way to talk to the doctors or whoever does the rotations to realize that these people can't work 24/7, especially with the stress they're also having. It's not just a matter of coming to work and doing what you have to do. Coming with the mindset of, I want to give you my best bet. I need to also stop at 6 hours instead of 8 hours, for example. I don't know, but it also depends on each person's resilience. So the few I have worked with, I really tried to get them to accept for themselves what is best for them and to make the decisions and the choices that will help them. You know, they also want to stay alive after COVID. They want to survive. They want to go on living. So it's basically know what you are dealing with, know what you can take, what you cannot take, and please speak up and refuse to be stigmatized, refuse to stigmatize yourself. I mean, we just need to keep talking.
Okay. So Mag, Bessem just dropped her question. She had her hand up. Bessem, I'm just going to go ahead and read your question to Mag. Bessem says, she knows you're very passionate about creating awareness to provide resources and education around, surrounding domestic violence. How has the COVID-19 impacted this particular domain in Cameroon? And what are the things that you think can be done in this regard?
With regards to domestic violence?
With regard to domestic violence and the impact on mental health. So for example, do you get women come to, has there been an increase in that?
Yeah.
Have you been having women and men come to you and complain about it?
They did many more in April when we were really on full lockdown. I thought it was going to be a fun time for couples, for example, but it happened to be a disaster time. Some said they couldn't stand each other. They were like, just leave, but leave to where, you know? And so, well, so it was women who came to me and they said they had to sneak. There's one from Bonaberu who had to sneak out of the house to come to me. She didn't want to talk over phone. She wanted me to see how she looked. She wanted me to look into her eyes and to see how desperate she was. And she wanted me to tell her where she could go to at that moment, but I couldn't tell her where she could go to because I don't have no shelter myself. But yeah, the lockdown made people feel like we have no escape. We have to stay together, and I can't do nothing. I can't go and see my friends. I can't go and do my other activities. I don't know the other activities some people do out there. So you are the only one, and I can't stand you. So at least I can beat you, or I can shout at you, or I can treat you anyhow. And so, yeah, that lockdown, it actually reduced the ventilation, let me put it that way, in the home. So yeah, some women had to suffer the brunt. I didn't hear of any case where it was the man who suffered the brunt of the lockdown.
That
But
is
it's
good
getting
though.
better now.
Because it's usually both ways.
Mama, this may just be the right time because she's talking about the men that didn't show up, right? It may just be the right time to follow up on John White's question.
Exactly. So while you were cut off back, we have a question from John White who says, how can we convince strong men that seeing a mental health specialist is not a sign of weakness? As we know in Africa and in our communities, men, even in the Western world, the men are the providers. They're the ones who are in charge. They have to be strong for themselves and for the family and for their wives and for the women. So how do you think they can seek for help without being seen like those who are the weaker person?
So if you don't mind, let me just say, such advice, I will need that kind of advice. So let's not look at the man that is imaginary. You know, I would need this kind of advice. This we have to convince ourselves, because I really want to make the most out of this.
My next book is going to be titled Rethinking Masculinity. I have started to do some research on that. I have 3 sons, right? So we have all of these conversations, and I don't think that they're going to grow up to think it's unmanly to seek for professional help, to go see a therapist. So what I say when I do my live videos is that you are not bound to convention. You are not bound to whatever it means to be a man. You can define what it means to you. I think we have all grown up. We crept, we started to walk, we did all of those things, and we are doing different things now. So it means you can change your own perspectives. You can change your own narrative. What you tell yourself, you're grown up now. So what does society have to do with what it means to be a man? What does it mean to provide, to protect, and all of that? Nowadays, is it only the man who does that providing and protecting in a family? So why not look at it from a different point of view? The more I get better, the more I speak up, the more I get help, the more I can do what I have to do, and maybe be honest enough to say, I cannot be a superhero. I cannot be a superman. I'm just a human being. I think that the men themselves, yes, they took it upon themselves to grow with this alpha status and aura, and then now they are stuck, and then sometimes they take it out on the women, like the man in Ohio, right? So that's what I think. Okay. Men, please drop it, change it. Nothing will happen to you if you say, I can't. My hands are up.
So we have Dr. Omarine, who is also a healthcare specialist, and she would like to chime in on this particular issue with regard to men and their manhood and this. So Dr. Omarine, if you can come on and ask and chime in just like you wanted to.
Hello?
Hello, we can hear you.
Hello, good morning. I'm working in the emergency rooms today. I am Dr. Omarine, board certified family physician. I help women overcome and understand anxiety so they can sleep better, cope with daily stress, and have the energy they need to build their life with no boundaries. I wanted to make a comment about men and just what it means to how we define manhood.
Sweetie, can you?
Wait,
oh.
Yeah,
Hello?
please go ahead.
Okay, I wasn't sure if I was, I'm in a small community hospital, so sometimes the Wi-Fi is like Cameroon. So I think that to tackle that issue, one of the ways will be from men themselves. To redefining manhood will have to involve men themselves, because in our society, it's almost it's a cultural, there's a strong cultural aspect. There's also the words we use to address men For example, growing up, I always heard men are bad, men are bad, men are bad, men are bad, men are bad. And we all know that the words you speak also determine how you basically bring things to pass. The Bible says it. As a woman of faith, the Bible says that as you whatever you speak comes to pass. So I have 3 boys myself, and I'm very intentional about the words I speak to them, so that they don't grow up thinking in a certain way. I also see male dominance as a lot of insecurity, which is basically ingrown, reinforced by us women and also reinforced by other men. And so, unfortunately, if a woman makes more money than man, then the man may feel insecure. And I'm happy to have this, to get input from the men on the panel as well. And the third thing that I've also seen is a lot of mental illness in men, where they may feel helpless, they may feel anxious, they may feel a lot of pressure to provide. And unfortunately, that comes out. Women feel, men act. So if a man is feeling insecure, if he's feeling anxious, if he's feeling low on himself, then he acts. And one of the ways of acting is by, maybe punching something, and that person may be his wife. So I think the way to start sorting that out and fixing it is also have these discussions, and also for men to be involved, and also for us to have clarity on, okay, when is it a mental illness? When is it just just poor self-esteem? And also involving, we have a lot of empowerment programs for women. We don't have as many for men. I feel that men need to be involved with other men so that they can redefine manhood for themselves. For me, as a mother of 3 boys, I'm doing it with my children so that they understand that being a man is not just going to work and coming back. It's also, talking and doing things in the home. So I think that I commend you, Mag, on even thinking about writing a book on that. I would really encourage the men in our group to just kind of reflect on those points and see how you can do something there, because we need something. For me, I have really changed my language in the way I address my husband, in the way I address men in general, and in the way I address my children. I refuse to say a man is bad or he's a bad husband and all that. I always say, he's bad, he's made a bad choice today. Thank you so much for allowing me to comment.
Great. Well, I'm talking because I see that you're on mute. So once you come in, but Dr. Asset, thank you very much for that conversation. It's one that needs to be had, and I have a follow-up question, which I'll probably direct to Marie, but Dr. Asset, you can also come in on that. You mentioned something as, when is it a mental health case, or when is it just a stress? What is the difference? Like, how do you know that this is no longer stress? This is mental health. Are they one and the same thing, or these are separate issues?
Okay, well, thank you for that. I think that when it impacts your ability to carry out your day-to-day activities, when you can't make rational decisions anymore, when, for example, as a health worker, you give the wrong prescription, or you put the wrong drip or wrong injection, when you start breaking things down, you start losing sleep for days. I usually say after 3 days of insomnia, please, that's a problem. That's not just ordinary stress anymore, especially as a health worker. You don't want to lose sleep 3 days in a row and then keep working. You're going to crash. So you don't want to wait until you start talking to yourself, or you start hearing voices, or you start, what can I say, you start being so angry, you know, rage, not just the ordinary anger. You know, once you really start, you know yourself, once you start to see that, you know, a nurse usually she's nice, she's welcoming to the patients and everything, and all of a sudden there's nothing interesting about your job anymore. You sigh every day before you go to work. You can't wait for close. You are thinking, the thoughts start becoming like, I'm getting infected. No, no, no. You wash your hands like 100 times in 1 hour. No, those are signs of something. So the best thing to do is catch it before it gets out of hand, and then go and be reassured, no, you can do this, you can do that, than to say, I want to wait until I lose it completely before I go, and then it's too late.
Okay. Now,
Sorry.
quickly, we just hit the 11 o'clock mark. We're going to push this to the limits to 11:15. So we have the next 5 to 6 minutes for questions, or 8 minutes, and then we can close at 11:15. But I'll turn that back to you, Mamo.
So guys, if you have any concerns, just like we said, you can throw those in. And I just wanted to say thank you to Dr. Omarine again for underlining that male dominance does mask insecurity, and it's something that we have to just address and know that it's we're all human and we're full of vulnerabilities. And just like Mag said, Mag, I have a question, just a really question with regard to COVID-19 now and healthcare workers. So we are in this phase where, do you see the necessity, since you talked about La Cantini, have you had these health institutions approach you to come to them and to talk about mental health, coach these healthcare workers who usually do not come to you to seek for help, but you actually putting yourself out there and actually informing them and telling them that there is some hope? Have you had anybody reach out to you to say they would like you to do that?
No. You know, first of all, mental health there's no mental health policy in Cameroon. So there is a draft somewhere. I heard about it in 2018, but nothing has happened to that draft. There's just a sub-directorate in charge of mental health in the Ministry of Public Health. And I have met her a few times, and she tells me there's no budget. And so seriously, if the World Health Organization and even the UN did not look at the need or the mental health impact of the pandemic, it would not even have been a cause for concern in Cameroon. It still isn't from the national level. You will not see no billboard talking about your mental health or the need to, no, not yet. So I haven't received any invitation. I haven't put myself out there to be invited in the first place. I'm doing just so much to even want to go and stand somewhere and be talking. Honestly, I don't think that I want to do that. But well, if I really did get an invitation, especially from a private institution, I would honor that invitation. For the time being, all I do is use my different social media platforms, talk to those who reach out to me. For health personnel, it's free. I don't charge them nothing because they are doing so much too. So for me, that's my own way of helping them stay grounded so they can continue doing what they're doing.
Well, thank you so much, Meg. And if we have anybody else who has a comment or a question or an observation, we'll be happy to just kindly look into that before we wrap it up. So reach out, let us know if there is anything you want to address. I see Christian's hand is up. So Christian, you go ahead.
Thank you, Mamo. I just wanted to respond to the call to action from Dr. Ase on the part of men. I think she really hit the point in the fact that the desire for most women, as a matter of fact, it's not just society as a whole, to raise the power and the voice of the women must include men as well. I think that's a component that has been missing in most of the activities and action towards that direction. The science is behind women and these activists. It really shows, look at the countries that have successfully responded to COVID-19, more than 90% are ruled by women. They know how to solve problems. They have the ability to take decisive action when the need comes, you know, in terms of responding to crisis. So how to do that? Dr. Asa gave examples of how she does it. You know, she's actually changed the language with her 3 boys, changed the language with her husband. And I think at the granular level, that's how these monumental changes can take effect. It's a cultural thing. You know, we are existing in a society that's been dominated by men for millennia. This change to have the same shared space with women is novel, it's new to us men, and it's also a power thing to suddenly ask us to share that degree of comfort and protection and security that we have been enjoying for so long. It's for some very insecure, and to have women become much more powerful when we traditionally have not learned how to deal with that. It's a difficult exercise. So I think that if, as you carry on your conversations, it is good to engage men as much as possible, especially men who have seen the light, if I may call it that way, because in reality, as I said, the science is on the side of really generating awareness and having women having an equal voice, because they do a lot of things better than we do. That's just what I wanted to say.
Okay, thank you so much, Christian. So, Ari, if you do agree with me, we have a few more minutes, but I'm just going to, I was hoping we're going to have a lot more men participate. I feel like that this discussion is a little one-sided. We have a lot of women, you know, giving their input, and we need men on board. I mean, this is something I always say: you cannot tie a hand with a bundle. You cannot tie a bundle with one hand, right? We need your cooperation, guys. This is something that affects all of us. Oh, I see. Phil has his hand up. So, Phil, you have the floor.
Yes, thank you. And I really want to thank Dr. Asif for really coming out on that, and Mag as well, because we're facing a very difficult time, right? And Dr. Miles Monroe wrote in his book, Understanding the Purpose of Man, to really try to educate men how we have to live and how we have to be better. There's that old dogma where I have to be like my father, I have to be like my sister, and we fail to understand that the times have changed. This is a different era. But what's struggling a lot of men today, they don't read. They don't want to be around the people who are doing the right stuff. And unfortunately, they stick to the old ways and continue down that destructive path, which hurts the whole family. And my hope, and the more these discussions are engaged, are had, more men will realize that they need to turn the page. So my challenge to my fellow brothers and uncles and fathers and grandfathers and soon to be others, look at the mirror and realize the person causing the problem is you. Because I grew up understanding, and going back to our generational way of life, the man is the head. If there's happiness in the home, you are responsible for that happiness. If there's sadness in the home, you are responsible for that sadness. But we need men to look for mentors. We need men to go out and seek for true leadership. It's not anything for you to think you can beat your wife, or because of COVID, I've been staying home, I'm working, I'm seeing this woman every day and I'm angry. That's a problem. You need to talk to the guy who is having a happy life, the guy who is peacefully loving the wife, not the guy who calls you up and says, you know what, I can't take it anymore. Let's go get a drink, this COVID thing, this woman. And if we turn around and look for those mentors, read those books, open our minds, because we thought going to school, getting a master's degree, getting a PhD, that's it. No, those things are not taught in classrooms, guys. I'm sorry. And that's what men need to realize. Women pick the books, they read, they get mentored, they listen to little groups. But men, we don't. We think, I know it all. And when you start reading, and to be honest, readers are leaders. Women are reading. They're reading a lot of books. That's why they understand they're getting the knowledge. Women need to read more. We need to be open more. We need to accept and take responsibility and say, okay, how can I be better? Because at the end of the day, even in the Bible, you're the head of the family. You're responsible for happiness. You're responsible for the sadness and all the outcomes. Thank you.
Well, I hate to spoil the party, but I know that our speaker, she's committed to another, she has to speak at another event or another forum shortly and may have to leave. In fact, she said she was going to push it to 15 minutes. Is that okay, Meg? Can you stay or you have to go?
Yeah, I have to go, but I just wanted to share that the World Health Organization has put out an interim guide which highlights the rights and responsibilities of health workers, including specific measures needed to protect occupational safety and health, that is mental health inclusive. So now the problem is that implemented? Are we even aware of that guide? What are we doing about that? So of course, the rights are to be implemented by governments through the various health units. Is it happening? I don't know. Maybe we need to do some research. When you're distributing the PPEs, you may want to ask them, like, while you're talking to them, you already have that opportunity. You know, ask them about their mental health, ask them if anything is going on, if anybody has come to talk to them, and tell them, well, we can get somebody to come and talk to you about this and that. I never know. That's just what I wanted to mention. And I wanted to say that putting in place these measures might help in maintaining the mental health of medical personnel and better treatment of patients, because when their mental health is stable, then they do their job better. Some people have died due to negligence, not only in Cameroon, but even out there. Maybe they were negligent because they were so tired. So it's very important that we don't neglect the mental health of our medical workers right now. I decided to stay in for 15 minutes more just to see how the conversation rolls out and to really not go without saying that you, the team, can also take that up. So while distributing PPEs the next time, maybe you want to invite a psychologist to come along. I know people in Bamenda, wherever, so I could always refer you to other resource persons who could accompany you during any of those your missions. So I want to thank you very much. I promise to be on another show at 5:15. This is 2 minutes into that. And you know me, I don't like black man time. So I really beg your leave, right?
Yeah. Well, thank you very much for being here and for doing that. And we're going to keep the conversation going for the next 15 minutes whilst you're gone. But I just wanted to thank you for coming on and for being gracious with your time.
My pleasure, and my regards to the team. Bye-bye.
Thank you, Mac.
Bye-bye, Mac. Thank you very much. That was really good.
Thank you. It was
Thank
awesome.
you.
Thank you.
Yeah, we're going to continue the conversation, Mamo, if you don't mind. We actually have 2 questions. I know Dr. Omerine Asser is here with us and is working in that space. I know Dr. Morgan is not a psychotherapist, but she's here and it's a healthcare worker is dealing with stress, seeing her colleagues dealing with it. This is the conversation that we're going to keep going. I see that we have 2 questions being asked. I'm going to let you proceed with the management of the conversations as we go. I know Dr. Marine wanted to say something, and maybe we will start there and then address the questions that have come up.
Okay, good evening again, or good afternoon again. I just wanted to answer the question that was raised about when is it a mental illness and when is it stress. And I wanted to answer specifically when it comes to men. So women feel, men act. So when a woman is depressed or anxious, you know, she closes up, she cries, she, you know, is you know, more emotional. You know, she may call friends or talk to people, but she feels, you know. A man acts. So what that looks like is, you know, he may shout, he may punch something, and that person may be his wife or children. He may go drinking, he may have, you know, engage in behaviors that are dangerous, like a lot of sexual activity, prostitution, or that type of thing. Unfortunately, in our society, we have accepted some things which are not, we've accepted some things as norms, which are not norms. So, for example, we accept a man who is constantly beating his wife or children, and we say, you know what, that's just how he is. When actually, that's not normal. There's also, even in our culture, as far as the women are concerned, there's a lot of undiagnosed anxiety when you see women yelling all the time and yelling and yelling and yelling and yelling and yelling and yelling all the time. So my comment is that, and what I have done in my home is, again, in my own small way, is to change the language with my husband. The husband is the head of the home. And when I see that he is repeating a few things that is learned behavior, I have verbally told him, this is not you. This is not the way you act. I know you. This is not the way you act. And sometimes that's all he needs to hear. I really commend all the men here on speaking on that. My recommendation is that as you go out with your brothers and connect with them, that you continue to bring up these conversations and speak, because there's no reason for a power struggle between a man and a woman, but we see a lot of that, where women tend to be really ambitious and they want to do all kinds of things, and then a man sees it as a threat. And so my recommendation for you, for me, I'm dealing with my husband and the next generation. For my brothers who are here, my recommendation for you is for you amongst yourself to continue to have those conversations, talk to your brothers down, and talk to your children as well. Thank you so much for allowing me to make this comment.
Thank you, Dr. Marine, and thank you for really being spot on with that and making our men know that it's something that we have to collectively address. And I believe that a part of your question, a part of your remark was addressed the issue that Martin asked, but I'm just going to throw this in here. So Martin wants to know, how do we deal with the problem of awareness among women in a society that is predominantly male, especially in the Cameroon context? I think, Dr. Marine, you have touched on that. Dr. Montio, I'm not trying to put you on the spot here. I hope I'm not. I was going to also ask for your feedback with regard to the discussions we're having today. This is something that also falls within your scope. I know you're not a psychotherapist, but you are a healthcare specialist who can help us understand how impactful this is in our society. And then after that, after your intervention, I'm going to ask the next question. Martin, please kindly let us know if your question was actually addressed by Dr. Omarine, or if you want somebody else to, or Dr. Montio to kind of shed a little bit more light on it. Thank you. Dr. Montio, over to you.
So first of all, I will make a declaration that I am an ENT surgeon, but I have a special interest in psychiatry and mental health issues. And I have a certificate also in psychotherapy, because a lot of physical disease and dis-ease originates from the mind, the societal upbringing and coding that we are given from when we were born, from our families, so the nature and the nurture that we have. And I think the question which you're asking me, that Martin Depp posed, is a very, very important one. How do you deal with the problem of awareness amongst women? Because a lot of the myths, the socio-cultural myths that are perpetuated about the man being the strong, the man not being, the man being the pillar of strength, not being able to show his vulnerability, not being able to engage on that human plane, comes from the education that we give them, just like Omarine said. And so we as women have to take responsibility for breaking these myths, have to take responsibility for enabling our fellow females, our mothers, our sisters, our mothers, even upline, because I have found myself in situations where I've seen an older sister who is in a situation that I wouldn't want to find myself, and being afraid because, you know, you respect your grand sœur, you don't talk about certain things. But when you are in a position where you are confused, you don't know where to turn, any help, any support is necessary. And so back to this issue about women, women have to take that responsibility. You're very right, Martin, to educate our sisters, empower and support our sisters and our brothers, so that we don't get into this, so that we break these myths. You know, it is a two-way route. Yes, we both, as women and men, have a different asset to bring to the table. We have our strengths, we have our different strengths, and acknowledging these, supporting these, not going down the route of, hey, you dey come out house because your man dey follow different woman. Now you be first man way, now you be the first woman way, a man come out outside. I beg, carry a thing and go back for house. That's not the way to support somebody who is in mental distress, because that is mental distress if you feel that you're being disrespected by your partner. So proper conversations, proper communication, having honesty and vulnerability between each other, understanding that it is a team, not a matter of one-way route. It's either my way or the highway, coming from the man or from the woman, because they are relationships where women definitely disrespect and maltreat their husbands or their partners. And then these two great nubbins of sexuality and finance, which are the basis of a lot of friction between couples. But we could make this a whole long conversation. And as Ari said, we're 3 minutes to the end.
Yeah.
Thank you so much, Dr. Montier. You nailed it as well. You just like put it exactly the way it is. This marriage is a partnership. It's like the life in general is a partnership. For you to be able to love somebody, you have to know what love is. For you to be able to appreciate somebody, you have to know what appreciation feels like. And especially in the context of COVID-19 today and its challenges and the world's challenges messing with all of our equanimity, I would say this is a very timely time and subject to address these matters. And I hope and look forward to us getting together again shortly next week with other very interesting discussions. I'm going to hand it over to Ari, and thank you all so much for participating. And we look forward to having you when next we're on. Ari, I'll hand it over to you.
Yeah, thank you very much. I think that we're going to have you come back as the co-host. I don't see any objection. so you seem to be a natural with this. So I'm looking forward to having you back next week, if you don't mind.
I'm honored.
We only wanted to provide personal protective equipment to healthcare workers in Cameroon, and look at what we uncovered. In just trying to address one need, we have found that there is a lot more than meets the eye. And that's what opportunities like this offer. We've even discovered talent in Mamwa today. So,
I think I just discovered it myself too.
So this is all opportunities that we are offered by just trying to do something that can contribute to development of Cameroon, just trying to protect healthcare workers. this path that we have been on has led us to so many good things. We had first a container promised us by a Japanese company, which I announced 2 weeks ago. And the following week, we had a second container. We have thousands and thousands of liters of hand sanitizers heading towards Cameroon. And a conversation now of, why are we just sending you hand sanitizers? Can we work with you to transfer technology to Cameroon so that we're helping produce this in Cameroon? And we just started a conversation now with the Cameroon Baptist Convention that is trying to start something, and maybe there's an opportunity for us there to scale what they're doing in collaboration with this Japanese company. So that the opportunities abound. The only limitation can be ourselves. That is the silver lining in what we're trying to do. And I want to thank everybody that took up time to be with us today. I want to thank you, the panelists, the members of the supervisory committee, Dr. Muntio, Dr. Omerina, for joining us. I hope that we all are living this richer than we got here, more empowered to take this, what we learned, and share with our brothers and sisters, our friends and neighbors. Well, thank you very much and have a wonderful weekend. No matter what you do, please stay safe.
Thank you so much. Thank you for having all us.
Thank you, everybody.
Thank you.
Thank you.
Thank you very much, everybody.